Hello, everyone, and welcome. Today, we're going to break down two important concepts in counseling and assessment, and it's kind of a little review of what we discussed last night. Appraisal and testing, and then we're going to explore the equally important ideas of reliability and validity in our measurement tool. We'll also take a look at a classic test, the TAT, the thematic appreciation test. And then we'll have a brief talk about why it's critical to clarify, define your construct before you start measuring anything. When we work as counselors or mental health professionals, one of our main goals is to gather information that will help us understand, support, and guide our clients. But not all information gathering is the same. And that's where the difference between appraisal and testing comes in. What is appraisal? Appraisal is the bigger picture. It is broad, ongoing method of collecting information about a person. It's not limited to one type of tool. Instead, we can use a combination of methods like interviews, behavioral observation, questionnaires, rating scales, client self-reports, and yes, formal tests. Think of appraisal as a building a puzzle. Each piece of information, whether from a conversation, an observation, or a test result, is a piece of that puzzle. The goal is to see the whole picture of the client's needs, strengths, and challenges. If you're doing a career appraisal for a high school student, you might gather information from an interest inventory, a structured interview, and teacher feedback, right? All those are so you can make a career appraisal. When it comes to testing, testing, on the other hand, is a specific and standardized procedure used to measure a particular trait, ability, or skill. It's narrower in scope and focus than the appraisal. It follows established rules for administration and scoring to ensure consistency. The result is usually a score or a set of responses that can be compared to normal criteria. That score helps us make objective interpretations. Later on in the evening, we talked about the TAT. The TAT is one of the famous example of a test, and the proper name is thematic apperception test, or TAT. It's a projection test where clients are shown a series of ambiguous pictures and asked to tell a story about what's happening in each one. The idea is their responses will project their underlying needs, motive, personality, dynamics onto the image. The TAT is about right or wrong. It's not about that. It's about patterns, themes, and how someone interprets a situation. It's an example of how testing can explore constructs that are harder to measure directly, like motivation, interpersonal needs, or underlying conflicts and traumas. The key to using a TAT effectively, or any test for that matter, you must first be clear about what construct you are trying to measure. And a construct is a psychological concept or trait you want to measure. Things like anxiety, self-esteem, resilience, or problem-solving ability, or dating, right? So when you try to define our construct, it's essential because it determines which tools you need to select. It shapes how you interpret the results. It ensures your assessment aligns with your purpose. So if you don't define the construct clearly, you risk using the wrong test or misinterpreting the data. For example, if your construct is social anxiety and you need to make sure the tool you use actually measures social aspects of anxiety, not just general stress. Okay. When it comes to testing, an important aspect, excuse me, is reliability. Now, whether we're talking about appraisal tools or formal tests, two concepts are critical: reliability and validity. Reliability means that a tool produces consistent results over time across a different settings when used by different people. A reliable tool is like a dependable bathroom scale. If you rate yourself 3 times in a row, you should get the same number each time, assuming nothing has changed. There are different types of reliability: test, retest reliability, scores say stable over time, inter-rater reliability, different raters give similar results, internal consistency, items within the test measure the same concept. Validity is synonymous with accuracy, while reliability is synonymous with consistency. Validity means the tool actually measures what it claims to measure. In other words, is it accurate? A scale might be reliable. It gives you the same number every time, but it says 5 pounds. If it says 5 pounds too heavy, it's not valid. There are three major types of validity. There's content validity, and it does, the key point of that is, does it cover all aspects of what it's supposed to measure? Construct validity, does it measure the theoretical concept accurately? And criterion validity, does it correlate with an established standard or outcome? Why does this all matter? In counseling, if we use a test that's unreliable, our results are inconsistent and can't be trusted. If we use a test that's invalid, it measures the wrong thing entirely, which can lead to incorrect conclusions, misdiagnosis, and ineffective treatment plans. And if we skip defining our construct from the start, we might be measuring something completely different than what we think we are, which is like aiming at the wrong target. So remember, appraisal is the broad, ongoing process for gathering information. Testing is a specific, standardized method for measuring one thing. The TAT shows how testing can explore deep, less tangible constructs. Defining your construct is the foundation of meaningful assessment. Reliability is about consistency. Validity is about accuracy. When we choose tools for our clients, we want them to be both reliable and valid, and to be grounded in a clear understanding of exactly what we're trying to measure. So thank you for watching this video. Keep thinking critically about your tools, your constructs, and your purposes of your assessment, because the quality of your evaluation shapes the quality of your counseling. I'd like to thank you, and I'll talk to you soon.